Introduction to Homeopathy. Homeopathy is an alternative medicine system recognized globally for its holistic approach to treating various health conditions. It operates on principles distinct from conventional medicine, primarily focusing on stimulating the body's inherent vital force to initiate self-healing. This system views the individual as a whole, considering physical, emotional, and mental aspects. The practice of homeopathy aims to restore balance within the body, rather than merely suppressing symptoms. It emphasizes that true healing originates from within, making it a gentle yet profound method of care. Globally, millions of people use homeopathy, with its popularity growing in many countries as a complementary health approach. Historical development of homeopathy. Homeopathy was developed in the late 18th century by Samuel Hahnemann, a German physician who was deeply dissatisfied with the harsh medical practices of his era. These practices often included aggressive treatments like bloodletting, purging, and the use of toxic chemicals, which frequently caused more harm than good to patients. Hahnemann sought a more gentle, effective, and individualized approach to healing. His pioneering work led him to experiment with various substances on himself and healthy volunteers, meticulously documenting their effects. This systematic approach laid the groundwork for a new medical system that prioritized the body's innate ability to heal. Hahnemann's rigorous methodology marked a significant departure from the prevailing medical norms, establishing homeopathy as a distinct and revolutionary practice. The law of similars, like cures like. One of the foundational principles of homeopathy is the law of similars, often summarized as like cures like. This principle states that a substance capable of causing specific symptoms in a healthy person can be used to treat similar symptoms in a sick person. Hahnemann discovered this by observing the effects of cinchona bark, which treated malaria, but also caused malaria-like symptoms in healthy individuals. For example, aconite, derived from the plant Aconitum napellus, can cause fever, chills, and restlessness in a healthy individual. Therefore, in homeopathy, aconite might be prescribed to treat a person experiencing similar sudden onset symptoms of fever, chills, and intense restlessness. This paradoxical approach aims to stimulate the body's own healing response, rather than directly counteracting the symptoms. Core philosophy, vital force, and holism. The philosophy of homeopathy is deeply rooted in the belief that healing is an internal process, governed by the body's vital force or life energy. This vital force is believed to maintain the body's balance and health, and any disruption to it can lead to disease. Homeopathic remedies are designed to gently stimulate this vital force, helping the body restore its natural equilibrium and self-healing capabilities. Unlike conventional medicine, which often targets specific symptoms or diseases, homeopathy adopts a holistic approach, treating the person as a whole. This means that an individual's physical, emotional, and mental states are all considered integral to the treatment process. For instance, emotional shock from a traumatic event can manifest as physical symptoms like fatigue or headaches. And a homeopath would address both the emotional trauma and the resulting physical ailments to restore overall balance. Individualization in treatment. Individualization is a cornerstone of homeopathic treatment, meaning that every person is treated as a unique individual. Homeopaths believe that each person's symptoms are a unique expression of their internal imbalance, and therefore, different people with the same diagnosis may require distinct remedies. This personalized approach considers the patient's specific physical, mental, and emotional state. For example, two individuals suffering from anxiety might present with entirely different emotional symptoms, such as one being restless and fearful, while the other is withdrawn and tearful. A homeopath would select remedies based on these unique expressions, rather than a generic anxiety treatment. This deep level of personalization is central to the success of homeopathic treatment, as it addresses the whole person, not just the isolated disease. Materia medica and constitutional remedies. The Materia Medica is an indispensable tool in homeopathy, serving as a comprehensive compilation of remedies and their associated characteristics. It provides in-depth descriptions of various substances, detailing their mental, emotional, and physical effects. This extensive body of knowledge guides homeopaths in selecting the most appropriate remedy based on a patient's unique symptom picture. Constitutional remedies are another vital aspect, chosen based on an individual's unique physical and psychological makeup, known as their constitution. This includes genetic traits, emotional tendencies, and overall health. For instance, a person with an energetic disposition, prone to skin rashes, might receive a constitutional remedy that addresses both their energetic nature and their specific skin issues, aiming for deep, long-lasting healing. Miasms, disease tendencies. A key feature in homeopathy is the concept of miasms, which refers to inherited or acquired disease tendencies. A miasm represents the deep-seated pattern of imbalance that can predispose an individual to certain types of diseases and mental states. Homeopaths classify miasms into three main categories: psoric, psychotic, and syphilitic, each associated with distinct disease patterns. For example, a person with a psoric miasm might be more prone to chronic skin conditions, allergies, and respiratory issues, often accompanied by a sense of lack or incompleteness. In contrast, a syphilitic miasm may predispose an individual to degenerative diseases or intense mental suffering, reflecting a destructive pattern. Understanding miasms helps homeopaths address the root, long-term predispositions to illness, aiming for profound and lasting health shifts. A law of infinitesimals. The law of infinitesimals is another fundamental principle in homeopathy, suggesting that the more diluted a remedy, the more potent it becomes. Homeopathic remedies are prepared through a process called potentization, involving serial dilution and succession, which is vigorous shaking. This process is believed to enhance the remedy's healing properties by imprinting its energetic signature onto the diluent. Even though these remedies are diluted to such an extent that often no molecules of the original substance remain, homeopaths believe the energetic imprint is retained. This concept, while challenging to conventional scientific understanding, is central to how homeopathy is thought to affect the body's vital force. For example, a 30C potency involves 30 steps of 1 to 100 dilution, resulting in an extremely dilute preparation. Materia Medica 1. Aconite and Arnica. Aconite is often called the first aid remedy in homeopathy, primarily used for acute conditions that arise suddenly and intensely, often after exposure to cold or fright. It's indicated for shock, fear, and conditions accompanied by extreme restlessness, anxiety, and a rapid heart rate. Physically, aconite addresses high fever, dry mouth, and intense thirst, helping to calm the nervous system. Arnica is another cornerstone remedy, particularly renowned for its ability to treat physical trauma, bruising, and muscle soreness. It is the remedy of choice for injuries from falls, accidents, or surgical procedures, especially when the individual is reluctant to admit injury or is sensitive to touch. Arnica helps alleviate pain, swelling, and bruising, and can also address the emotional shock following an accident, promoting faster recovery. Materia Medica I. Belladonna and Chamomilla. Belladonna is a key remedy for conditions involving intense fever, inflammation, and sudden onset symptoms, such as tonsillitis, ear infections, and throbbing headaches. Patients needing belladonna often present with a red, flushed face, dilated pupils, and marked sensitivity to light, sound, and touch. It helps reduce inflammation and calm the agitated state. Chamomilla is widely used for individuals who are irritable, impatient, and easily angered, particularly children experiencing teething pain or adults with acute emotional distress. A chamomilla patient is hypersensitive to pain, reacting with intense frustration, and may demand constant attention. It soothes discomfort from colic, teething, or joint pain, bringing emotional relief. Materia Medica I. Ignatia. Ignatia is a significant homeopathic remedy primarily used to treat emotional distress, particularly grief, loss, and mental shock. Individuals needing Ignatia often exhibit paradoxical mood swings, moving from deep sorrow and weeping to irritability and anger. They may struggle to process emotions, often suppressing grief, which can manifest as physical symptoms, like a lump in the throat or digestive issues. This remedy helps to release emotional tension and supports the individual through the grieving process, restoring emotional balance. For example, a person who has recently lost a loved one might experience profound sadness, but find themselves unable to cry, leading to a feeling of tightness in the throat. Ignatia can help unlock these suppressed emotions, allowing for healthier processing of loss and promoting healing from both emotional and physical manifestations of grief. Materia Medica 2, Pulsatilla. Pulsatilla is known for its influence on individuals who are deeply sensitive, changeable, and often weepy, experiencing mood swings and emotional instability. These individuals frequently seek affection and reassurance, finding relief from crying. They are often described as gentle, affectionate, and childlike, with symptoms that fluctuate based on weather or emotional states. Physically, Pulsatilla can address symptoms like dry mouth, constipation, or colicky abdominal pain, which often improve with fresh air or walking. For instance, digestive distress after a stressful event may find relief from a walk in nature. This remedy is particularly suited for those who feel emotionally vulnerable and benefit from external comfort, helping to balance hormonal fluctuations and restore emotional stability, especially during menstrual irregularities. Materia Medica Nux vomica. Nux vomica, derived from the seeds of the strychnine tree, is a homeopathic remedy for individuals experiencing irritability, frustration, and digestive issues, often linked to excesses. These individuals are typically driven, ambitious, and possess a strong desire for control and perfection. They are highly sensitive to external stimuli like noise, light, or strong odors, which can easily agitate them. Symptoms are frequently aggravated by stress, overwork, or excessive consumption of stimulants, such as alcohol, coffee, or spicy foods. Digestive problems like indigestion, constipation, or bloating are common, often accompanied by a tendency to anger. For example, a businessman working long hours and consuming excessive coffee might experience digestive discomfort and irritability, for which Nux vomica would be indicated to address both physical and emotional states. Materia Medica 2, Sulfur and Phosphorus. Sulfur is a widely prescribed polycrest remedy for chronic conditions affecting the skin, digestion, or emotions. Individuals needing sulfur are often introspective, restless, and dissatisfied, with a strong desire for freedom and a tendency to reject conventional norms. Physically, it addresses itchy, inflamed skin disorders like eczema and acne, and digestive issues such as bloating or diarrhea, often accompanied by a feeling of being overheated. Phosphorus is effective for highly sensitive, impressionable, and compassionate individuals who are easily drained by their surroundings. They are prone to respiratory issues like asthma, bronchitis, and colds, as well as emotional conditions such as anxiety and fear. Symptoms are often triggered by emotional stress and can worsen at night or with external influences, like loud noises. Phosphorus helps improve lung function and restore emotional balance. Materia Medica 2, Rus tox. Rus tox, derived from the poison ivy plant, is a powerful homeopathic remedy used to treat conditions involving joint pain, stiffness, and skin eruptions. It is particularly effective for individuals who experience discomfort in muscles, joints, or ligaments that worsens with rest and improves with movement. The pain is often described as aching or burning and is aggravated by cold, damp weather. This remedy is commonly prescribed for conditions such as arthritis, rheumatism, and other musculoskeletal issues. For example, a person with chronic back pain that is worse in the morning or after prolonged sitting, but improves with gentle movement and warmth, would likely benefit from Rus tox. It also helps treat skin rashes like shingles that cause itching and discomfort, stimulating the body's healing response and promoting mobility. Materia Medica 3. Arsenicum album. Arsenicum album, also known as arsenic trioxide, is a highly significant homeopathic remedy for individuals experiencing intense anxiety, restlessness, and a strong desire for order and control. These individuals are often perfectionistic, obsessive, and constantly worried about their health or the well-being of their family members. It addresses both emotional distress and physical ailments. Physically, Arsenicum album is commonly used for gastrointestinal distress such as nausea, vomiting, and diarrhea, especially when accompanied by restlessness and anxiety. Patients often experience coldness, relieved by warmth, and general weakness that worsens with exertion. Respiratory conditions like asthma or bronchitis with burning sensations can also be treated, highlighting the remedy's broad action on both mental and physical spheres. Materia Medica 3. Bryonia. Bryonia, derived from the plant Bryonia alba, is a homeopathic remedy commonly used for conditions involving dryness, inflammation, and intense pain, particularly in the joints, muscles, and respiratory system. The Bryonia individual tends to be irritable, withdrawn, and prefers complete rest during illness, as their symptoms significantly worsen with any movement. This makes it a key remedy for conditions where stillness brings relief. Physically, Bryonia is often indicated for joint pain, rheumatic conditions, dry cough, pleurisy, or pneumonia. The characteristic feature is pain aggravated by movement, such as a headache or muscle pain that intensifies with physical exertion. It's also helpful for dehydration, manifesting as dry lips, mouth, or skin. Emotionally, these individuals may feel bothered by the smallest things and desire control over their environment, preferring quiet and calm. Materia Medica 3. Kali carb and Hepa sulf. Kali carb, or potassium carbonate, is frequently used for weakness, fatigue, and respiratory issues, especially those affecting the lungs and chest. Kali carb individuals are emotionally sensitive, often feeling burdened by responsibilities, anxiety, and deep-seated fears, particularly concerning their family's health. They may feel easily exhausted, as if carrying a heavy weight on their shoulders, and often need reassurance. Hepa sulf, or calcium sulfide, is a remedy for infections, abscesses, and inflammation, particularly in the respiratory system, such as sinus infections, boils, and tonsillitis. Individuals needing Hepa sulf are highly sensitive to pain, irritable, and hypersensitive, often craving warmth, as cold exacerbates their symptoms. They may experience sharp, stabbing pains and a tendency towards pus formation, making it effective for conditions like pimples or carbuncles. Materia Medica 3. Lycopodium. Lycopodium, derived from the club mossa plant, is a remedy commonly used for individuals experiencing digestive issues, low self-confidence, and feelings of inadequacy. Lycopodium individuals often suffer from chronic digestive problems like bloating, flatulence, and constipation, which are exacerbated by stress or emotional upset. They tend to be highly ambitious but often lack the confidence to achieve their goals, leading to frustration. These individuals often have a deep-seated fear of failure and a strong desire for approval from others, presenting as perfectionistic yet overwhelmed by their own expectations. This lack of confidence can manifest as indigestion or gastric discomfort, particularly after eating rich or heavy foods. Lycopodium helps address both the physical digestive symptoms and the underlying emotional state, improving self-confidence and reducing anxiety. Case-taking, foundation and components. In homeopathic practice, case-taking is the foundational first step, involving the gathering of detailed information about a patient's health, lifestyle, and personal history. This process goes beyond merely listing symptoms. It aims to understand the underlying causes of disease and the patient's unique constitution. A thorough case-taking session provides the homeopath with essential data to comprehend the patient's overall well-being, including their emotional and mental state. The art of case-taking requires skill and patience, with the homeopath listening attentively and asking open-ended questions to make the patient feel comfortable, sharing their experiences. Key components include personal history, medical, family history, lifestyle, physical symptoms, specific pains, digestive issues, sleep, mental and emotional state, responses to stress, anxiety, sadness, environmental and social factors, work, home life, relationships, past traumas, emotional or mental stress, origins. Key symptoms and repertorization. After gathering all relevant information, the next crucial step is to identify the key symptoms, those most characteristic of the patient's condition. Each symptom is analyzed in depth, considering its quality, e.g., sharp, dull, burning, location, where it is most pronounced, and aggravating or ameliorating factors, what makes it worse or better. These details provide essential clues for remedy selection. Repertorization is a vital tool used by homeopaths to match a patient's symptoms with a remedy from the homeopathic materia medica. It involves looking up symptoms in a repertory, an index of remedies organized by symptom categories. This process helps narrow down potential remedies by cross-referencing the patient's unique symptom picture with remedies that have similar qualities, guiding the homeopath to the most appropriate choice. Chronic conditions analysis. When dealing with chronic conditions, homeopaths analyze symptoms over a longer period, recognizing that these conditions are often multifaceted and involve multiple layers. This requires considering not only current symptoms, but also the patient's medical history, past traumas, and emotional state. A careful examination of the patient's life history can reveal underlying causes contributing to persistent health issues. For example, a patient suffering from chronic migraines might report triggers related to their menstrual cycle and stress alongside a history of emotional trauma. A homeopath would explore these connections, selecting a remedy like sepia, known for hormonal headaches associated with stress and emotional trauma. This comprehensive approach aims to address the root causes of chronic illness, leading to long-term healing rather than just symptom management. Homeopathic remedy selection principles. The art and science of remedy selection is a core practice in homeopathy, requiring in-depth knowledge of the materia medica and skill in analyzing patient nuances. It involves matching the patient's totality of symptoms, physical, emotional, and mental, to the most appropriate remedy. This holistic approach ensures that the chosen remedy resonates with the individual's unique constitutional state. Homeopaths also employ differential diagnosis to distinguish between remedies that may appear similar but are suited to different individuals or conditions. For instance, headaches could indicate nux vomica if linked to indigestion stimulants, bryonia if worse with movement, dry mouth, or belladonna if sudden, throbbing with fever, light sensitivity. This precise differentiation, considering aggravating and ameliorating factors, is crucial for effective treatment. Polycrest remedies and diagnosis. Polycrest remedies are highly versatile homeopathic remedies with a wide range of uses, capable of addressing a broad spectrum of symptoms across various conditions. The term polycrest comes from Greek words meaning many uses, highlighting their broad applicability. These remedies are frequently used for acute conditions, chronic illnesses, and constitutional treatments due to their ability to address a broad range of physical and emotional symptoms. Period. Common polycrests include arnica, sulfur, nux vomica, and pulsatilla. For example, sulfur is used for skin conditions like eczema and psoriasis, digestive issues, mental restlessness, and chronic fatigue, making it a primary consideration for deep-seated chronic conditions. Arnica, while known for injuries, is also effective for emotional shock. The effectiveness of polycrests lies in their ability to address the underlying constitutional state of the individual, treating the whole person rather than just the disease. Understanding homeopathic potencies. Homeopathic remedies are prepared through potentization, a process of serial dilution and succussion, vigorous shaking. This method is believed to enhance the remedy's healing properties by increasing its energetic or vibrational frequency rather than its physical substance. Potency, therefore, measures the degree of dilution and the energetic concentration of the remedy, not its material strength. The basic idea is that the more diluted a remedy, the deeper and more powerful its action becomes. Lower potencies, example 6C or 12C, typically act on the physical level for acute symptoms, while higher potencies, example 30C, 200C, or 1M, act more deeply on mental, emotional, and chronic underlying causes. Potency is expressed in scales like centesimal, C, decimal, X or D, or millisimal, LM, with 6C meaning 1 part diluted 100 times, 6 times over. Potency selection factors. The selection of the correct potency is crucial and depends on several factors. For acute conditions, lower potencies, example 6X, 6C, 12C, are typically used for sudden, transient symptoms like fever or headaches, aiming for a quick response. Conversely, chronic conditions, deep-rooted imbalances, or constitutional treatments often require higher potencies, example 30C, 200C, 1M, to bring about profound, lasting improvements by addressing underlying causes. Patient sensitivity is another key factor. Very sensitive individuals may respond well to lower potencies, while more robust patients might need higher potencies. The nature and stage of the disease also influence the choice, with early or acute stages often benefiting from lower potencies, and chronic stages requiring deeper acting higher potencies. Finally, the patient's vital force or overall vitality is considered, as those with high vitality may tolerate higher potencies better.